Next in Community Connections HealthWise, what injuries or conditions should bring you to the emergency department? HealthWise is brought to you by Winona Health. Healthy starts here.
Get down!
Today, we continue our visit with Winona Health Emergency Department physician Dr. Joe Koo about what situations require a trip to the emergency department. At what point do you be seen for a burn? Sometimes you might just touch a hot pan and in passing, it's nothing. You run some cold water on it and put some cream on it, you're fine. But what point does that burn become severe enough that you should get it looked at?
I'll just go from an anatomy standpoint, just from head to toe. So basically, anytime you have issues burn within the face or within the mouth, those need to be seen very soon, just because the thermal heat, the radiation of it can go into the back of the throat and cause a lot of swelling, and it can affect the airway, which is very dangerous also. And so with that said, and then how big is this? How big are we talking about? I usually count like my fist as what we call a 1% body surface area of burns. So if you could take your fist area and measure yourself out, and you see that you're more than 3-4% or 3-4 fist, much of that, then I'll definitely be seen, because you have a higher risk of a couple things: dehydration, also a higher risk of muscle breakdown, can lead to something called rhabdomyolysis. And the last thing is, obviously, if there's a full body burn, it doesn't matter if it's a second degree or third degree burn, those need to be seen very quick here, and most likely that will be an emergent causes for multiple treatments, not just in the ED, but in the future of what needs to be done.
Now we're in August now. We've got the dog days of August fast approaching, and it's probably going to get hot again, a lot of humidity like we had before. What about heat exhaustion? Is that something, if somebody's seeing the symptoms of that, do we take care of that on our own, or should we come into the ER? What can we do? What should we do?
So things that to look for is obviously signs of called a mental status, when someone's not behaving well, like himself. And also the people who maybe work out in constructions. Sometimes they want to work, their mind is so strong that they want to keep working and working, but they're starting feeling lightheadedness, feel like they're going to faint, they're going to pass out. Those kind of symptoms. Also, when they're, they feel like their heart's beating faster and faster. And then the most dangerous sign, I think, is when they just, pass out and doesn't respond, or two, they look like they're so indifferent that they don't understand what's going on. They don't know who they are or what, where they are and what time it is. Those kind of things are very things to look out for too. And the last thing is, if you touch their skin, from a physical exam standpoint, although it's 101 degrees or 90 degrees with a huge humidity rate, they're not sweating at all. And that person has been out there a long time. So, and those definitely need to be seen. At least, first you get in a cooler environment as fast as you can. And expose their skin, and make sure to put a lot of just spray mist, like just a wet cloth, just to keep them cool down, and just get them away from the sun.
Something I've experienced recently, I tripped and fell and hurt my foot, and I was just kind of hoping it was a sprain, but after trying to walk on it for a day, it was obvious it wasn't right, and it turned out to be broken. I probably waited too long maybe to come in, or is that kind of normal? People tweak their foot or their leg or something, and it might be broken, but they just don't think it is? How do you gauge when you go in?
I mean, I think you're like anyone else. The things that we worry about, especially in small parts of the body, like foot and the hand, you hurt your foot before. Just tough it out a little bit. But what you said was very key to the exam is you try to walk on it and it's worse. And those are times when you have to be really careful to come in and at least get checked out. Make sure it's not broken. And there could be other things. Your foot is very complex with other parts of the body, like there's tendons, there's ligaments that could cause some pain there. But just check out, make sure it's not broken, I think is a very good idea. And also to look for signs of brokenness has been, especially with kids, they can't tell you exactly what will happen, but you'll see it by how they walk and how they function. They're not doing what their normal activities. They seem very scared about it, or they just had no interest in it all of a sudden, which is obviously different. So those are things that I definitely look for. And it's never too late. It really isn't to get it checked out. But sooner the better, because of the different parts of the bone. There's some complexity to it. Some will go straight to the operating room, or it could be splinted and have follow-up. So those, with that in mind, I think sooner the better, and also the location of the injury.
Coming up next, reasons why you should use a realtor when selling or buying a home in Curb Appeal.